I now have the pleasure of introducing a very good friend of mine. We've been working on similar programs for a long, long time, and that is Dr. Grace Sun. She's been practicing advanced laser and cosmetic dentistry in her Los Angeles practice since 1983. She's a well-renowned educational advocate and published author. Dr. Sun holds several prestigious statuses, including the Master of Academy of Laser Dentistry, General Dentistry, and Master and Educator of Academy of Laser Dentistry. She's also a master with the International Congress of Oral Implantologists and a fellow in of the American Academy of Cosmetic Dentistry. She's a very talented cosmetic dentist, and she was the first female accredited fellow of the American Academy of Cosmetic Dentistry. She served as 7 years in the AACD's Professional Educational Committee, and Dr. Sun has been sitting on the ALD board since 2001 on different positions. She's also received the Leon Goldman Award for Clinical Excellence in 2020, and is in line to become our president in the ALD in 2025. She's also been made an honorary president of the Asia Pacific Laser Institute in 2022. So Grace, the show is yours.
So we are among the masters, and I'm very honored to be here. And I hope all of you are having a good time and learning all this new technology. And I really love laser, and because laser helped me open my eyes and widespread my horizon, able to provide better service for my patient. All of us are healthcare providers. Our job is to provide the best service for our patient to improve their health. I believe laser is one of the tools that can help us to get there. And now, the next section that we talked about it is another bonus about laser dentistry that I received the bonus in 1997 when I started using surgical lasers, and at the same time, I realized the benefit when you use lasers. It's not necessarily technique, what you can do, make your job easier to achieve what you can do for the patient, but the expectation of the patient experience is so much better. And my job as cosmetic dentist, because that's how I started by building my practice as cosmetic dentist, and patient's expectation, you want to meet patient's expectation. At the same time, the whole experience got to be superior experience. And that's what I found when I'm doing all the surgical procedures, and what they experience is the special service. It's not necessarily the technique. Sometimes, yeah, of course, the clean feel and all that, no sutures, and all that is a good thing. But they don't really have any post-op discomfort afterwards. And at the same time, I also learned low-level laser therapy at the same time when I obtained the laser unit. My first unit was actually argon laser for laser bleaching, because that's part of what I do, cosmetic dentistry. And at the same time, I realized the story behind laser. I'm from Los Angeles. The first laser is discovered, was built in Malibu in Los Angeles. So I always felt that connection. But at the same time, I also realized the low-level laser, the story about that, in 1965, how the benefit of low-level laser discovered from the hair growth in the laboratory rat when you shave it for, see whether the low-level, like a ruby laser, can cure cancer in the mice, which it didn't happen, but at the same time, they realized the hair growth so much faster on the group that receive that low-level laser therapy. So that's what we call therapy, no longer surgery. Today, what I want to talk about is patient service, the bonus you can learn while you're doing laser treatment. My background is, I got a lot of different branches of dentistry that interest me and try to always achieve the highest level you can do because I want to provide the best service for my patients. And I'm an acupuncturist. That's also from my young age, watching my mom. She was always helping handicapped people, and she used acupuncture to help them, and also other manual therapies. So I have that influence, and I believe the channel, the whole body is one, what we can do and to help patients. So that's one of my philosophy. But today, what I wanted to do, it's not just like, okay, it's not surgery we're talking about here, but it's a therapy, it's a healing that we can do as a therapist. So it's a photomedicine in a way, it's light, photon that we're working with. I will be specifically talking about photobiomodulation. It starts as a low-level laser therapy, but it is light that we all benefit from the day one. So it is like form of light therapy is like, yeah, it's, I'm trying to read this. I better go down a little bit. So a form of light therapy and utilize laser or LED and broadband light. So all lights we can utilize to help us to achieve the objective, what we're trying to do with it. But three things about PBN. So it's to help the generation with the tissue and reduce inflammation and pain and adjust, regulate your immune response. Yes, any treatment we provide for our patient, we need to have a clear understanding what causes the problem, where the symptom come from. And so we have to lay out all the treatment options as well. So when you're dealing with orofacial pain, in reality, all the dental problem falls into that category. Then we have muscular area we need to deal with it. So it's orofacial pain. It's like, yes, you have many ways to look at it and many treatment options. We're talking about photobiomodulation today. So it is the spectrum of the energy. Traditionally, we use red and infrared. But recently, we also add to the 400 to kind of blue light range as well. So that we continue. This is ongoing research on this field. So it's a lot of hope, and don't get all uptight. Exactly protocol I need to know. Parameter, it's different when you do photobiomodulation. Depend on the host. So it varies. We're talking about energy. So bottom line, what's happening in the cellular level, we have many organelles in the cell. One particular organelle, the mitochondria, that's what we're looking at. So the double membrane of the mitochondria have this ability to absorb the light. And once they absorb the light, they produce adenosine triphosphate, the ATP, with the unit of energy. So once you've been energized, you can do things better. It's like we become Wonder Woman or Superman. If we have that energy levels that high, we can heal better and faster. So photobiomodulation, when the light hits your body, and many different parts of that body will respond to it. So that's all the actions happen, having a party there. So this, yeah, for women, I love that collagen production. I do like red light. The red light goes right to your skin, increase the collagen production. So you have, less wrinkle, But it's basically, if you look at the body, all the things are happening, all the events happening because the complexity, how a body is composed of it. So every part is responding to the light. So we have like on the bone structure, bone remodeling. So you're talking about, all right, implant surgery. You're talking about orthodontic bone remodeling. That can benefit using photobiomodulation point of view. And nerve regeneration. So that is a very difficult part to get into to help patients to get better if they have neuropathy. So this is a part of it we can help with the light energy, besides a pharmaceutical or other surgical procedure. So inflammation or muscle recovery, that's a very important part in the sports world. So you don't want people get injured and you want them to recover faster. Photobiomodulation has been used in the National Football League. So typically they have to go through that to prevent injury. So Michael Hamlin, he has this book, Basic Photomedicine, talked about. So if you look at on the left side, this is the cell. So you see the organelle, you see the nuclear, you see the mitochondria, all these things, gene transcription, and happen. So the growth factor production, you have the cell proliferation. So all the things, that's why things will happen quickly under the photobiomodulation once they receive the photon. So the body will react in a way, so it's wound healing, tissue repair, and release inflammation and pain, edema will decrease that. And so in the acute injury, it heals quick. So photobiomodulation in dental patient works very well if you just do the procedure. And in the chronic situation, it will take much longer to heal. We need to be patient about it. And so you can see neuropathy, this is one part we can help patients with. And acupuncture, that's another new area, new and old, because acupuncture has been around for thousands of years. But using photonic energy incorporated with a meridian system, that's another new approach. This is my dental patient, if you look at it. Because they sit in my dental chair, I'm just like, why are you not comfortable? So they tell me because they had skin cancer. So it's still not healing well. I have a look, all right? So I see that's 3 months after the surgery. So I gave him a unit to help him to continue, do some treatment. Did some treatment at chairside for him. And that's 2 weeks later, after he came back for the crown delivery. So it's amazing what you can do, and patient will love you to death. That's what I do for patient. So actually, this is a review, what's going on. So see the mitochondria, increase ATP production, get energized, and the gene transcription that's happening in the nucleus. So all the things, it's part of the photomedicine and the beauty of the PBN. That we review what physiologically, what we see, the person's ability to heal is increased because the photonic energy that added the energy to the cell, and when you energize, you can just perform better. Another branch I mentioned, it's an old and with a new approach and new look at it. So acupuncture has been around, so it's adjunct treatment. And we have a lot of new approach to look at acupuncture, what's doing to the person. So we do have the neurotransmitter has been increased. So that's from a functional MRI, you can look at that. That's happening. General principle, this is just general principle, very simple. Stagnation causes pain, and start chi flow, the pain goes away. If we're really into Chinese, I don't know how many Chinese down here, but every word in Chinese has a story. We can talk about it when we have more time. But it just, every word, it just tells you, for example, we say 不通则痛,通则不痛. The bu is how the arrow gets stuck, so it doesn't go through it. Tong is supposed to be a soldier that goes on the vessel. That's how it's supposed to move. But if it doesn't happen, and that means the soldiers got sick. And so that's a story each word is. It's very beautiful about Chinese culture. Meridian system is the extensive, invisible, and sophisticated network of the energy that channels throughout the whole body. So we are connected head to toe. So my technique right now, working with a PBN and combined with the acupuncture, is this is what I'm trying to do. We do have the channel. Where you put it though. So that's another thing we can learn about it. And I'll teach you how to, how to get that concept. It's pretty easy. Yes, how many points, yes, depending on where you learn, there's many different theory can be from 361 to thousands. So that means the channel or the points means the gate where you can get into the channel to connect the energy. So it is that World Health Organization, they started saying it's 360, somewhere there, but they increase the points on the clinical relevance. So you add the technology or knowledge, so it's from the old study, but they're evolving all the time. It is like in general saying that you have those channels. You have one problem, you might need several things combining to treat that problem. Or one point can be used to treating different things as well. So it is a diagnostic knowledge also is required for this. But if you use Western point of view to look at it, so those is also National Health Institute, the director, Helena Langevin, she spent years studying acupuncture. So those are her studies. So you can see the points are actually is very superficial, so very easy to locate them. But it is it's meridian. It's talking about you looking at the connected tissue. So we are connected from head to toe. So we're talking about fascia. Fascia is wrapping around all the structures of our body, and then they are connected tissue. Then they connect from head to toe, and the energy it's actually flowing around those fascia layers. And the fascia do have different components that Family talked about it earlier. And so it is looking at the whole body as one. So it is how this is distributed through the whole body, and what's the structure involved, and what's in the fascia. So that we're talking about the connected tissue, the connected nerve ending, capillary vessels, fibroblasts, and undifferentiated mesenchymal cells. And so growth factor can affect and get in different desired direction we want it to be, and lymphocytes, all that. The benefit, you're doing acupuncture, you have some local effect, and you also have some central effect. This, what you can see. This is functional MRI. This is a well-cited article. It is to see how you put a needle in different part of the body. You do a functional MRI, you see the response. So at certain points, you'll respond more. And what I do to teach, or in dental patient, is to work with what? For example, if you see, I see liver 3, LI 4, that LI is large intestine 4. So these 2 points, we work together. So those are like LI4 we call 合谷, large intestine 4 is the points between your first and second metacarpal bone, and it means your thumb and index finger where they connected. That's where your large intestine 4, then it goes to the foot, the same thing, the first toe and second toe. That metatarsal bone connected, that will be your liver 3. So these two, actually 4 points connected together, you activate them, they will very effectively control the pain level, the whole body pain. So it's many points that has certain, some are more central effects, some have less. But it has been studied that do have that connection. So the name of photoacupuncture is still pretty new. It starts in 2018. That's being established in the world. So they were talking about photonic stimulation of acupuncture points and area to initiate a therapeutic effect similar to that of needle acupuncture and related therapy together with the benefit of the photobiomodulation. So photoacupuncture, how we do, what kind of the equipment or energy that we're working with, where'd you get those photonic energy? And so that will be different technique involved. But basically it's red and infrared, maybe infrared is even more effective, goes to deeper. For example, in this picture, you look at that, you know that's large intestine 4, on that point, that's large intestine 11. If you look at those, it's where the joints. Where the joints usually that has more abundant connective tissue, and that's where you can find the points. So you connect it, and this is just, you turn on, the energy goes to that, and you can have that some effect. And we do have further study since then about how to activate the points. But all this, if I put acupuncture and PBN, look at it, they're very similar what they're doing to the body. So these two actually have synergetic effect. You combine them together. And the important part, where do you put them? How did you find them? So that's what we need to go back to review our anatomy. If you're treating orofacial pain, then you try to remember where are the muscles, then you do the palpation, are they trigger points, what's going on. So you want to see whether the relations, so let's go back to understand the anatomy. So how many bones we have on our facial structure and cranial system, how many muscles involved. So we got to review all that, the joint area. So then you try to understand, you study your meridian system. How many meridian system go through the head area? So it's 8. So all this you try to connect it. You look at, go down to the skeletal area, the joint, the bone and bone joint together, muscle insertion. All these are kind of important. So if I study a trigeminal nerve neuralgia patient, if I'm treating the patient with PBN, of course you go back to etiology and what's going on and treatment options. But once you start using PBN, treating that patient have that symptom, where you start. So you do the palpation. You know the anatomy, you know the master muscle, how they located, and you do the palpation accordingly. And you find where the tender spot. So you record it, so then you will treat the whole muscle area. You will treat the ashi point, that's the tender point, that's the name we call ashi point. And you look at the standard classic where the acupoints, and then you add your ashi point, and you look at the mapping where the muscle goes, And you kind of, those are the area you will treat to relieve the symptom, or we call stagnation. We can get rid of the stagnation and help the qi to flow. And I do mapping because I felt a lot of chronic problem, it's not what you will treat them once. A lot of the time there's a repeated treatment. It's like you want to become a stronger person. So from this level of health to this level of health, it's a journey. It's not one treatment or twice or once a week. So it's a continuous providing your body needed the energy, which I'm talking about besides the dietary, besides your body posture and etiology, all this area needs to be addressed. At the same time though, we need to be patient. From step A to step B, it's a journey. When your body from this condition to this condition, the healing is a process. So be aware of it. It's a very different way to look at the treatment. So it's not drill and fill. It's different type of treatment. When I usually treat a patient, I know they need to have continued at-home treatment. I will draw the map. So I will circle the area where they need to treat and follow, then we follow, and then we check on the patient. So, but it is you work with the patient and they're willing to go through that, and you provide the photobiomodulation if they can do it at home. That's a new concept as well. That's a treatment you can have them do it at home. And that's also part of the self-care. We can learn about how to take care of ourselves. So the zoning map or the technique, what I'm teaching, because when I say muscle, it's hard to understand each where. So I usually define as coronal, frontal, or cheek, jaw, dental area, orbital area. So that's the type of things I will use when I explain where to treat. So the zoning area, if you look at again, it is, I try to look at layers, what we're looking at. We're looking at bone, we're looking at muscle, I'm looking at channel. So that's the kind of interesting, you're putting things all together, look at this person. Again, I'm talking orofacial, but it is, body is a one. So it is that you can say this is local treatment, and we can also reach, start from here treating your orofacial. So that's called distal point, but they all connected together. So you find where it's the most easy to treat, and we know we have certain things we call source points. That's treating specific channel, which point's the most effective. You can approach that and get energy to it. So in a way, these things can be, I'm talking about like here and there. It's a lot of stuff I'm putting all together, but it's the exciting things. And I look at my patient from the day one. I start treating patients as a cosmetic dentist. I know the happiness I can bring them, how they look at themselves. And so I was very blessed, started as like happy moments I'm creating for the patient. And once they become your patient, your heart is out for the patient, you realize sometimes it's not the technical stuff or, that is your attitude. You want them to be better. You want to do better things for them. It's the service. So overall, I feel laser dentistry allow me and allow all of us to get to that service, that patient experience, to a higher level. And it is a bonus that we learn how to make the surgical laser become therapeutic tool. And do we have other tool that's easier to use, which it isn't progressing. From what the day one, the surgical laser, to today, you have a more photobiomodulation available for us to provide that service. from the dentist or from the Western point, we're always treating local area. So if we're treating local area, fine, but always thinking about if you just step on something, a grain of sand, you actually feel the pain all the way to your head. It is connected. It's never a local area because we're not built that way. The complex network, it's always there. So today, what I'm saying is this, yeah, we always say evidence-based knowledge that we want. But I want you to just relax for a moment. It's thinking about the human, how our body is built. So we have to appreciate how the body is built, appreciate our position, appreciate what's available today, and just open our eyes and thinking outside the box a little bit and be excited about it. There's a lot more we can learn to help our patient. In that, the little boy there, that's the boy, actually, it's a special group that I'm fortunately working with a neurologist. They're treating like kids of ADHD and autism kids. Those kids are not easy to treat. She can use some of the tool that she used, PBN, to actually activate the cranial system. So she can only do so much for the kids. They need to continue to do at home. Sometimes it's very tiring for the parents when you have kids need so much energy. So there are tools available today. Transcranial of PBN effect helps the kid. And in this kid, what he has is showing you a hand. He gets excited. He likes the light. They feel calming because if you put the light around the auricular area, just here, because you know the cranial nerve is really tight into our ear area. TNJ is here. Okay, cranial 5, 7 is right around your ear here. So on the 8 and 10. So it's all there. But the reason I talk about the kids, he gets excited about putting his hands. He feels good about hand. How many bones we have in our hands? 27. So just this hand's 27 bones. Thinking about how the bone connection, think about the fascia layers, think about the nerve, think about the muscles. So in that sense, there's a lot of meridian system right in our hands, and it's shallow. So the light actually putting on the kids wearing it, they feel good. I think just something we can use the photobiomodulation to help every patient we come, or every person we come in contact with. I just feel that we're blessed as a therapist. And we're blessed, we have technology that today people working on it and share the knowledge with us. So we have the tool, we have the method, we can learn more about moving forward to help as health care provider, at the same time help ourselves because we work very hard. So I'm working in dentistry for a long time, and many decades. You really want to know? 1977. So I've been working with my hands and for many years, and I'm also pianist. I'm also painter and sculptor, and I do many, many things. And I build my own porcelain. This is a disclaimer, I'm sorry about that, but I develop things for myself. What the boy wears, this is what I develop for myself. So I wear, and so I don't stop working, I continue to perform and to do things that I need to do. My point is not trying to point to any device because it's continuous, this new device, new technology available for us. I'm just feel we're very excited in this era, and things are moving so much faster. The technology and the knowledge is available. You can just at your fingertips. And by the way, I treat my patient. I give them all the when they sit down. I really love them because they pay me well, and they pay my so I can pay my staff well. So everybody is well. It's not struggle. At the same time, we can continue to think about what we can do in return to serve the patient better. So that is something that it's like exchange. But at the same time, I feel I'm very happy with my staff. They were with me for 30 years, 20 years. So I see them what I need to help them to. I don't get sick, but sometimes some of the staff will get sick. I will help them to give them knowledge as well. So I treat them as family. I treat my patients as family. And so I always try to see what I can make them feel better. What I have to say, I get into laser technology, it is because I want to do better for my patients. Because I want to get that bleaching finished right away, and they can walk out and get that smile. And I believe, same thing. It's crown lengthening and all that aesthetic procedure. Once I have the laser, make things much easier. But it is technical sensitive. It's very important that you join with a group of people can share the knowledge so you can grow faster. So I also very appreciate I'm part of the Laser Academy, and which I have learned tremendous. I have many mentors in there, and you always learn and from another person. When you join together, you'll grow faster. You'll become stronger. So let's see what I have here. Oh, this is the reference page. I do invite you to join us, ALD member. We do have the September annual meeting. We also have a special advanced learning program. That's a one-year program. It's a fellowship and master program. And I will be actually probably starts in April. I will be talking in depth about photobiomodulation, and I will talk about actually it's connected with TCM concept, how that beauty of you look at yourself as one, and how these things can go together and learn about it and get excited about it. I have to tell you, the reason I love acupuncture so much is the connection I have with my mom. My mom passed away very early when she was only 49. But she told me I would be a good dentist. So I became a dentist because of her. But I miss her. But anything connected with her, I'll go for it. So acupuncture is part of the respect what my mom's background. And I got into it. And a flower arrangement that I do for my office all the time is also from her. And that's part of connection. You always have the heart there, and I have the heart connect with all my patients. So I always like to find out what I can do to help patients, and we are all healthcare providers, every one of you in this room. And we're very lucky in this room to share all this. And so the first part, photobiomodulation, in that program, will be share with the colleague about photobiomodulation and photo-acupuncture. And our speaker, Dr. John, is here, so he and me will share in June's program, talked about what we do with ortho and pedodontics with the laser. And so that's all I was sharing here today. I'm taking questions now if any one of you have questions. You can always grab me when you see me around, but if you have any question, wants to ask me, the floor is open.
Yeah, thank you, Doctor. Great presentation. I'm a board-certified orofacial pain specialist myself. I'm here.
Okay.
I'm a board-certified orofacial pain specialist myself. And as you correctly said, like we use multiple modal therapeutic modalities for management of orofacial pain. How do you select your patients for for photobiomodulation? I mean, is this your first line of therapy, or you combine it with other therapeutic modalities as well? Because for myofascial trigger points, we use a lot of spray and stretch, trigger point injections, and all those stuff. For trigeminal neuralgia, again, we use the pharmacotherapy as well. So do you, start with the photobiomodulation yourself straight away, or you go with the other therapeutic modalities? If those don't work, then you go on to photobiomodulation.
Excellent questions. I actually have a lot of slides. I only choose, 30 slides here because I thought I would run out of time. But the lecture comes to orofacial pain. I never really label that I treat orofacial symptom. So my practice is cosmetic dentistry that I'm known for. And that's what I do. But when patient coming through your door, you see them as a person. You're trying to understand their background. And you see wear and tear, you see worn down dentition, you see dentistry kept on failing. You do want to know why. And then they do have problems. You do the palpation. So you ask questions because you want to do the work and make sure your dentistry will continue to serve them for many, many years. So you do look at that person, the whole thing, and understand that. So the orofacial pain patient, sometimes it came in for orthodontist, because I'm also orthodontist, so when they come in specifically for ortho, adult ortho, or a young generation for ortho, I look at everything like Dr. Olivier talked about it. That's part of the oral myofunctional therapy or the maxilla and all that. And that do the palpation, it's part of it, yes. The trigger point, over 90% is the acupoint. So it is related. Now, we're doing the injection. That's really look at the fascia layer. All that you try to separate, all that adhered layers. So that's something acupuncture's principle. You put it in there, you start moving, you start separating. That you want to work that fascia layer. That's cupping, you're pulling it. So when I do photobiomodulation, I do manual therapy as well. So it's not just the light itself, but you also want to activate the whole system. Again, it's not necessarily local treatment. You also look at the lymphatic system. So you're treating something there, you want that activation started here, but go through the whole system, get rid of it. So if it's a chronic problem especially, it's very important to activate your lymphatic system. So we also learn lymph nodes. So we know where we get to palpate your lymph node. We know how to activate it, subclavian and supraclavian area. You need to activate that, even just with the pressure. You can use the light or just to activate with your pressure. And then go to the pre-auricular and post-auricular area and follow your jawline. Follow your, the craniofacial, you need to do the whole thing. So those cranial systems, you want to work with your manual pressure as well. And photobiomodulation is definitely part of it, and that I do. And continue, but do some treatment in the office, that you should respond pretty quickly. At that time, that one visit, 20 minutes, they should feel the release. And you also use you do the RON. You can do that and see the change quickly as well. You remeasure it. So all that response, and you get that, and you also help them, whether the occlusal therapy, what you need to get in and manage all that. So it is complete, areas that you have to look at the complexity there. There's a long checklist, but that's how you can control from this to this easier. I hope that answered your question.
Thank you, doctor.
Yeah. Excuse me. Excuse me, Dr. Sun?
Yes.
I have a question. Where can we buy these photobiomodulation devices?
Uh, we do have some very well-made and inexpensive units that are available at this conference. And it's my company, I established a company for that. It's called Oral IQ. It's at the Hall 6, A13. We do have a special price for if you're interested, but that's the technology I want to bring to your attention and get excited about it.